So I'm going to go over to Kim. We have Kim in the live stream. Are you able to hear me, Kim? Kim,
Yeah,
can you hear me?
hi.
Very good, Kim. How are you?
Good, thanks.
Very
Thanks.
good.
Um,
Welcome to
I'm,
welcome to Ria Power Hour.
Thank you. I just found out about you guys, so I'm just here to get more information.
Sure. Yeah, no, of course. Just so I can know a little bit more about you, would you mind telling me about who you are and where you're calling from?
Oh, sure. I'm calling from Washington State, the southeastern part of Washington State, where it's very
Okay.
hot right now. And yeah, I'm, a younger stroke survivor, 11 years post, and single mom. And yeah, I'm
Okay.
just finishing up grad school. So,
Ooh, Kim, what are you studying?
social work.
Social work. Okay. There are not enough social workers out there in the world. And so I'm glad there's another one out there, or soon to be at the one out there. How's that journey been for you?
Good, really good. I
Okay.
mean, just, yeah, good. I had to push out graduation one semester because of COVID,
Okay.
because I couldn't find an internship because of the
Sure.
pandemic. But now I'm in my final internship and it's virtual. And so yeah, it's almost over.
Very good. Very good. Well, congratulations on completing that. It's a very, very important position in the healthcare field. So very, very glad that you are there and going to contribute to that. And so actually, I'm a little bit interested. I'm a little bit going to ask some selfish questions here, if you don't mind me asking. What's been your experience so far? Have you been working in the hospital, outpatient settings? What's been your primary area?
Oh, well, I haven't, as I'm a career changer. So,
Okay, sure.
really, my first internship was in a hospital,
Okay.
which was, it kind of ended up just being discharge planning, like case management.
Yep.
This one is with an employee assistance program. So it's very,
Okay.
people call in, it's very brief. They only get between 1 and 3 sessions. So
Mm-hmm.
it's very solution focused,
Okay.
counseling and therapy. Yeah. And I did what they consider the integrated track for my program. So focusing both on clinical stuff, working directly with people, but also macro social work like community work and policy work and things like that.
Very interesting. Very, very holistic. Okay.
Yeah. And so I honestly haven't really done it yet.
Sure. That's okay. Well, it's called practice for a reason, right? Very good. Well, okay. So I think you mentioned that you are a stroke survivor, 11 years post injury. Tell me about your experience with your own recovery. Then tell me how that started for you and what you've been doing since then.
Sure. I mean, I did, in the very beginning, I think I was 5 weeks in inpatient rehab.
Okay.
And at the end of that, I still couldn't transfer independently from the bed to the wheelchair or anywhere else. Then I did 6 months of outpatient PT and OT, probably between 2 and 3 times a week. It was so long ago now, I don't totally
Sure.
remember. And then I was kind of like booted out of that because I don't know, I guess I just sort of came to the end of my insurance. Um, and then I was kind of just floating around. And then I just started going on my own to other clinics for PT and OT. But it got to the point where, really I was only going once a month because with copays, that's all I could afford.
Sure.
And as much as I, have intended to do things at home on my own, it just doesn't end up that way. I just don't have the time, or I don't figure out a way to make the time. So, kind of, I don't know if this is how it goes for everyone, but in the beginning, of course, recovery came in like leaps and bounds.
Yep.
And then, now, of course, and then it sort of slows down and it's all very incremental. But even now, if I do practice, I notice improvements. I notice differences all the
Yeah.
time. So, and I just kind of stumbled onto this. I was looking for something else online the other night, and this just seems like kind of an amazing way to, get all the repetitions into, one of my first PTs would always say, you have to do it 10,000 times. You have to do it 10,000 times. That's just the only way you can make gains. So.
Yeah. Okay, very good. Yeah, I think really like your sentiment. I very much appreciate understanding where you're coming from as well. Like, that's quite helpful. I think your experience is very, unfortunately, very similar across many stroke survivors insofar as you kind of exhaust a standard path, and in most cases, vast majority of people do not reach their maximum medical recovery because of that, because of insurance and limitations and all these sorts of things. So I think I'm really glad that you kind of found some of these alternative approaches. And so I think it really depends on kind of where you are right now in terms of the type of functional abilities you have and what type of things you might want to focus on. So would you mind maybe just expanding a little bit in terms of what's still challenging you and what type of things would you like to get out of a system like this?
So as far as walking, I mean, I have pretty major vestibular issues, and
Mm-hmm.
I was speaking to a rep earlier on the phone today for you guys, and I was asking if, can using the foot apparatus help with the vestibular issues? And, he explained that it can't help directly, but it can help indirectly just because, through repetition and sort of training your brain, that this is how you do it. One of my main problems is, and I think this is probably pretty typical for people, I hesitate to put weight on that affected side. And, and I overcompensate, and, and then also for me, it's not, it's difficult to place my foot exactly where I would want it.
Yep.
And then, as far as the hand, I mean, I've got, pretty good, I don't know what percentage I would give it, what a, functionality that I have, but, it's hard to, I can't really carry a glass of water across the living room, let's put it that way,
Okay.
without spilling it all over the place or dropping it,
Sure.
those types of things. And I do, of course, use my good hand way too often because I'm always in a hurry. Because, yeah, I could try and like unload the dishwasher,
Mm-hmm.
solely with my affected hand. But, in reality, I need to get things done because I don't
Sure.
have all the time in the world to do that.
Sure.
Which is, yeah.
No, no.
So I don't know if that.
There's zero judgment here in this world, Kim. So don't worry. Don't worry about that at all. I think all of us appreciate your perspective and can understand the struggles of trying to integrate rehab into your daily life. And it's like, well, it also, what happens when I drop the plates? Well, now I got to go make another trip to the IKEA to get more plates or whatever, right? So yeah.
Everything stops. You have to clean it all
Yeah.
up. Yeah.
Yep.
And I'm tired.
Yep.
I'm tired of losing glasses. I'm tired of losing plates.
Yeah.
Well, I had been going, until COVID hit. I've since moved, and well, not since COVID, but I had been going back to PT and OT,
Okay.
pretty regularly, like maybe once a week, twice a week, but it's still just not enough. And
Mm-hmm.
one of my PTs who's really good, I mean, everyone I've seen has been beneficial in some way. Like I know it all matters. But one of my PTs, last year said, well, I think maybe you just get to a point where you just don't recover beyond that. And my thought was, well, I don't know, maybe with conventional PT and OT, that's the case.
Mm-hmm.
I don't know.
Yeah, Kim, I think this is really important to mention too, that this is a really important one. And you would think that if it's such an important question that science would have answered this yet by this point. And truth be told is there are very few instances when individuals who are stroke survivors have been pushed sufficiently hard to actually get to like a real ceiling, a true ceiling. And what I mean by that, and some scientists may come back and say, well, yeah, we have done that. And it's like, well, maybe you have, but the problem is most clinical studies are limited to 3-month periods, 3-month epochs. And we all know that recovery can take much longer than that. And so, yeah, maybe 6 hours of therapy a day is going to be a saturating response, where anything more than that, it's going to be, you're not going to get any benefit from it, or potentially even some negative effects. But what happens when you extend that 3-month period to maybe 6 months, 9 months, a year? What happens then? Are we able to then continually progress? And those questions just haven't been answered yet, just because the way that, unfortunately, science is funded. And so I think, to your point exactly, maybe these conventional approaches, the sort of constraints that are applied to conventional rehab approaches kind of limit the maximum medical recovery that any individual person can take. And this is, this is my contention. As a scientist looking at the data, as also someone who's been involved with these sort of technological solutions, try to help circumvent those problems, those limitations. So I very much resonate with that perspective. And so, truth be told, is we also don't know a whole lot about the individual determinants, right? Maybe you are a very good responder to certain things, and you may need XYZ type of rehab. And in those cases, it's going to be even harder to get the information just because of the complexities of trying to parse that, scientifically speaking. So the better thing to do is to try to optimize on some outcome. And this is what the algorithms actually look for, right? Because you're using the machine, you're using the Motus hand. It's a robotic system that goes on you, and it's sensing all your movements. And as you start to increase your range of motion, your strength, your precision of movement, these sorts of metrics that we can record, it's going to detect that. And it's going to try to make suggestions to continue to amplify those bits of progress. And so in that case, it's very personalized insofar as it's going to watch how you're performing, take the things that you're doing well, and try to figure out, okay, what things are driving that? Well, let's push those harder to ultimately sort of maximize a medical recovery. So very much resonating with your perspective there, Kim. You were also talking about sort of the hesitancy during gait. I think that's a combination of things, right? Of course, vestibular systems, very, very complex. And I hope you're actually doing vestibular rehab. I've actually done a bit of this myself. So I'm a traumatic brain injury survivor, and I've done a fair bit of vestibular rehab because that's where a lot of my deficits were too. So I think we should very much look into some of those options to do vestibular rehab. It can be very, very effective. I've seen personally a lot of benefits from that. But in terms of the confidence of the lower extremity help, Motus Foot is really good about sort of developing proprioceptive control. So being able to kind of negotiate the sort of sensory and the motor aspects of the foot and the ankle, really, really important for balance. Something like that could help sort of give you some more confidence and more stability during your gait. So the one thing I would recommend, though, is to not bite off too much, right? You've already mentioned that you're super busy, you get ready for a career transition change to go into social work formally. So I think the best thing to probably do is, if you were to proceed something like this, start with one, and let's see if we can integrate that into your sort of course of self-care, and then take the next steps, potentially considering doing both, or maybe doing one after the other, these sorts of things. So that would be kind of the recommendation. But do you have any sort of questions for me about how the systems work? I'm happy to go into any details.
I don't have a specific one right now. I mean, I've looked at the videos, and if I have one, I'll chime in.
Very good. Well, thanks so much, Kim. I appreciate the opportunity to chat with you. And so with that, what I'm going to do, I would encourage you to stick around. We got plenty of other individuals to chat with. And so I'm going to go over to my next guest, Roxanne, in a second.